10 years ago, Bernadette Brandon was stationed in Germany when a motorcycle accident ended her Air Force career. It also left her with back pain that has only gotten worse over the years.
They really couldn't diagnose it. They just said back pain, back strain, because the MRIs, a lot of things, everything, nothing was showing up.
Living in Florida, she saw doctors at the University of North Carolina and the Mayo Clinic, but her pain was only spreading and intensifying. More recently, she moved to Detroit to be close to her family. And her pain today?
My pain starts on my left side at my lower back, and it comes around the hip into the groin. It feels like fire. It's with me all the time, just the intensity flares up to like a 10 when it's unbearable, but for the most part, it's always there.
Bernadette's mother works at the Detroit Medical Center and suggested the pain management clinic at Sinai Grace Hospital, headed by doctors Renee Baugh and Mohamed Othman.
We have a wide range of treatment options and availability within the DMC and locations to give patients access to pain management.
It's multidisciplinary approach. You need the pain specialist, you need the rehab doctor, you need the neurologist, you need the spine surgeons, you need the psychiatrist even.
It was Dr. Othman who was able to help Bernadette with a high-tech procedure that uses electronic stimulation of the spinal cord to block pain signals to the brain.
I just remember telling Dr. Othman that, wow, wow, because he told me, speak clearly because you're going to be kind of out of it. But I just remember saying, wow, I noticed a difference. So I noticed a difference immediately. And
no pain, it was gone.
It was gone. It was relief.
That's what Bloomfield resident Marcia Lichvar came looking for at the pain management clinic at Sinai Grace. Ever since an operation 3 years ago that fused a bulging vertebra in her neck, she's had constant, intense pain.
Where is your pain concentrated?
Through all the way from the middle of my back up to the middle of my head and across my shoulders and down my arms.
Marcia tried to fight through it with medication, but the pain took over her life.
I can't work without the medication, pain medication. So I no longer teach. I'm very limited in what I can do.
Before treating Marcia, Dr. Othman described the procedure.
What we're going to do is one of the high-tech new procedures in the pain management, which is called spinal cord stimulator. Our whole goal is, through stimulating certain nerve tracts, to prevent the pain signals from reaching through the other nerve tracts to the higher pain centers in the brain by creating electromagnetic field at the level of the spinal cord.
The doctor said he starts with a trial run, inserting the stimulator but connecting it to a battery outside the body. That way, the patient can live with it for a week or two and gauge its effectiveness.
That's the catheter.
In the operating room, Dr. Othman showed me the thin catheter that he will position along the spinal cord to deliver the stimulation intended to relieve Marcia's pain. And then, with the patient sedated but still responsive, he inserted the catheter and moved it up the spine using an X-ray machine to guide it precisely.
You see the plate in her neck? That's where she had the surgery.
With the catheter in place, the team used this electronic device to fine-tune its position. Then Dr. Othman started talking to Marcia.
Where do you feel the stimulation? Do you feel it in the middle of the back?
The doctor is questioning the patient in an effort to determine where the stimulators provide maximum relief. In effect, this allows the patient to participate in her own pain management while the procedure is taking place.
So it's covering the middle part of the back?
As he continued to get Marcia's feedback, Dr. Othman worked to position the catheters to provide stimulation to cover as much of the area affected by pain as possible. And afterward, his report was good.
You said you got about 80% coverage, right?
Correct.
What is the desire? What's your target when you do this?
Well, of course, 100% will be a good
Sure.
desire, but it's unrealistically. Anything above 70% we'll consider well. We always give some room because when the patient is laying down, when he sits up, there will be some fine movement. So that will increase or decrease the area about 5 to 10%.
Marcia left the outpatient procedure with a smile. If she's pleased with the results over the next several days, she will return for stage 2, in which a small battery will be implanted below the skin. Bernadette is looking forward to her own stage 2 procedure and to reclaiming her life.
I love being active, out there rollerblading, riding a bike, working out. So it'd be nice to get back into the swing of that again.
At the pain management clinic, Dr. Baugh says success is measured by the patient.
I base my success rates on the patients. The patients get to be the ones to say, yes, it was success or not. I might look at them and say, you're doing much better. It seems like, this was a success. Your pain has been treated successfully. But if they say, no, I still can't do what I really wanted to do, then they get to be the gauge and the measure for their success.
Visit us here at dmc.org to learn more about pain management at Sinai Grace Hospital, or to make an appointment with Dr. Baugh or Dr. Othman and their fine team at the clinic.
The DMC, we just think it's a better way to get better. I'm Emery King.